Rachel, thank you for your post. I can't agree more with your statements that empirical evidence that MAT works is overwhelming. Researchers such as Dumchev et al. 2017, Osterel et al. 2019, and Vogel et al. 2016 substantiate the data. And even though it is swapping one opioid for another, at least the opioids that are being used in MAT are helping uh, are helping the patient to somehow arrive at some sense of stability. You know, they also say these researchers that MAT alone is not sufficient for most patients as you pointed out. Psychotherapy must be included in the recovery process to take advantage of the cognitive control the patient is regaining with the assistance of MAT. This camaraderie between both can help the patient strengthen and increase abstinence motivation, according to Osterl et al. 2019 and Vogel et al. 2016, by addressing harmful thinking and, and behavior and transforming it into thinking and behavior that raises the individual's quality of life. Psychotherapy is also beneficial to address psychopathology or comorbidities that the patient is assessed to have. In addition, the partnership between MAT and psychotherapy should assist the patient in seeing and believing that full recovery can be a reality. I appreciated the quote that you quoted, better yet, Osterel et al. 2019, when they write, the current opioid crisis is an opportunity to change the way we think and do things, moving beyond a medication only approach to a future when we will establish a generalizable framework that uses the full repertoire of responses and resources we have at our disposal. Because another approach that can be combined with MAT and psychotherapy with the consent of the patient is religiousness and spirituality, or RS, an approach that is not receiving much discussion in our readings. Um, Much research has been conducted on the benefits of religiousness and spirituality in recovery oriented programs. Sanchez Iglesias et al. 2021, for example, stated that there is optimistic data that our religiousness and spirituality, especially those employing a participative action approach, a biopsychosocial perspective, and a social support and recovery capital focus on can help in terms of treatment, social reintegration, and relapse prevention. Puffer et al. 2012 stated that positive religious coping seems to have a protective effect as it was associated with lower opioid use and higher 12 step participation. Puffer et al. 2012 added that while some participants entering treatment initially said they did not have or ascribe to a religious background, when they were asked how they planned on coping with issues, they responded with leaning on God or a higher power. Therefore, for a more holistic approach to treating opioid and other addictions, and to truly have a full repertoire, as Osterel et al. Mentioned, there must be a partnership not only between MAT and psychotherapy, but also religiousness and spirituality. Thank you, Rachel. Blessings to you.